Welcome to Successful Parenting, where we, Jackie Rue and Robin Choquette, share practical skills for families to build resilience and healthy connections. As practicing professionals and parents ourselves, we hope this podcast is a resource for parents to grow, reflect, and learn more about themselves and their children. Our approach is simple, tangible, and most importantly, we lead with compassion for the integrity of the families we serve. This podcast should not be taken as medical advice and is intended for informational purposes only. We love our work, and we can't wait to watch families gain confidence and open themselves up to new ways of successful parenting.
Good afternoon, Robin.
Hi, Jackie. How are you doing today?
I'm doing good. It's after winter break, all the children are back at school. And so I know today is actually a snow day for us here in Chicago, but things are going good.
Yeah, the snow is coming down, I think, on many parts of the U.S., and it's really been needed, though. Here in the Midwest, it's been pretty dry, so that is certainly needed.
I'm looking forward, even though it's a snow day, to this episode this morning, and I'm super excited for our guest expert, Dr. Cecelia Horan.
Yes.
I have known her for many years, and she is an expert in the Chicagoland area, has been instrumental in developing child and adolescent services for Ascension and Health, which is a Chicagoland major hospital system for behavioral health for children and adolescents. And so she has so many different levels of experience. She's worked in residential, she's worked in private practice, she's worked in clinics, and she's done a lot of consultation and training for students and newer therapists. And she's also helped develop and oversees the Perinatal program, which is integrated throughout the Ascension program.
Yes, Cece is an amazing clinician and just a wonderful person. You just learn a lot when you watch Cece work with families and talk about families. It's a real pleasure to just be in her company. So I am excited for this conversation.
Yes. Welcome, Dr. Horan.
Yes.
Hi, Robin. Hi, Jackie. I want to just say back at you, ladies. We've worked together for many years. A while ago, you two both have taught me a lot as well. It was great running our school anxiety school refusal program together. It's a pleasure to be here with you again.
Yeah, feels good.
Well, it's so interesting just getting the hang of all the podcasting and being virtual and even still being able to have a conversation. It's cool. It's not something that we would have done probably even 5 years ago.
Right.
Dr. Horan, what part of your experience or what do you feel like has drawn you to want to work with families, to be so invested in, especially a lot of your experience focuses on helping families when their children are struggling with all different kinds of presentations and issues?
I have thought about that. And I think that just explaining my background a little bit would be helpful in answering that question. I started my career running residential treatment centers for wards of the state. I started when I first got out of grad school after I got my doctorate at Maryville Academy. It was their first residential treatment center. We had about 12 kids. We then moved to a different facility, opened a residential for boys and girls. Then I was at ULIC Children's Advantage Network for a while. And all of these kids had very serious histories of abuse and neglect, and they didn't really have a lot of family involvement. So that was probably about the first 10 years of my career. In reading research, one of the best prognosis for kids that have any histories of abuse or neglect is that they have some type of family involvement.
Mm-hmm.
I was lucky then to land a job at Alexian Brothers Behavioral Health Hospital, which is now Ascension, Illinois. And that then gave me an insight into how we can really work with families to help the kids. I think that one of my favorite things is when I first meet with a family and sometimes here's my kid, fix them. And I'm like, okay, your kid's not broken. And this is really a family system problem. So we're all going to need to make some changes. So it's been very hopeful to me in this last part of my career to be able to work with families and teach parenting. That's also why I so enjoy your book and your podcast, because I think one of the best ways to help kids and teenagers right now is to work with families. So it's great that you guys are all champions of that as well. So that's kind of what led me to really digging into how do we work best with families? How do we teach them to parent? And how do we teach a family to work together?
It's that protective factor, right? Relationships. So if the family unit has bonded relationships, then I would imagine that is probably the reason that research shows that how important families are in the life of a child and being able to develop the milestones, for emotional development and all of, across the board. Would you agree with that?
Oh, absolutely. I think connection, which is one of the things that I like to work with parents on, connection is key. I think that sometimes we don't know how to connect with each other because we do connect in different ways. We use in my perinatal program love languages because I think that we all want different things from others in relationships than we sometimes want for ourselves.
Mm-hmm.
And that leads to a disconnect sometimes. So, just teaching families and people how to connect, I think, is important.
Yes.
What would you say? I know when a lot of families come to you, they also are probably feeling just so in despair, right? Like, my child's struggling, they're not going to be okay. And I know one of your approaches is to really normalize for families that just because your child's struggling doesn't mean that this is not going to turn around. It's part of the development. And I think you really have a nice way of helping parents just to realize and not freak out. Because I know you talk to parents a lot about, not reacting out of just your own emotional stuff and not freaking out and not calling everything a tornado. What are some of the strengths and obstacles families may hit when attempting your approaches or when you're working with them? What do you notice about families when their child really starts to struggle?
Well, I think I'm going to jump back to what you were first talking about, Jackie, because I think that one of the frameworks I use is based on Bessel van der Kolk. And he calls when people are traumatized or in crisis, they oftentimes have a disorder of hope. And I think the families and the parents in particular come in and they are feeling exactly like you said. They're overwhelmed. They're feeling hopeless. So I think part of our job as mental health professionals is to instill hope back into the family system. Sometimes I say, I'm going to hold your hope for you until you're ready to take it back. The other framework that I use to help, as you said, kind of normalize this for parents, sometimes to talk about other families that I've worked with and how they've come through very similar types of situations. But even taking a step back from that, I'm very much a believer, and I think it helps people sometimes when they come in and they're like, kid is diagnosed with this or that or whatever. I'm not keen on diagnosis. I'm keen on symptoms, but I often tell the story that I think that we're all crazy and it's a matter of degrees. I believe that mental health is on one side, being mentally unhealthy as on the other, and that we have a little window and we move towards being mentally unhealthy or being mentally healthy based on a whole host of things, what's going on, stressors in our lives, hormones, developmental age, all of that. And what we try and do with families and with our kids is teach them how to right themselves with skills to move towards being more mentally healthy. So I think it's a lot of just, you can do it. We've seen this before. You're not alone. In our partial programs, I think that's one of the most powerful parts of our group-based modality is that kids come in and they see that they are not the only ones that have these feelings and thoughts, and that they can develop ways to deal with their emotions and their negative thought patterns.
Cece, what did you call it? Was it despair?
Disorder of hope.
Oh, disorder of hope. I like that. And I use the same thing when you talk about I'll hold your hope. And I don't know if I learned that from you or not, but that was definitely something I use with clients. And I think it is helpful, and especially for parents and families coming in who just feel like it's so chaotic.
Right. I mean, you're meeting people when they're at their most vulnerable. And I think that's also important. And I work a lot with new staff and with students on the fact that we need to meet our parents and our patients where they're at and not where we're at, because sometimes they're just in a place where they don't have any hope. They don't think anything's going to work. They're very vulnerable. There's a lot of acting out behaviors or shutting down anxiety. And it's okay that that's where they're at, and we will help them. One of the things that I often talk with parents about, in particular in the first session or when I'm even doing consultation, is that we need to understand that kids and teenagers, everybody knows this. You've probably had some expert on the show talking about the fact that kids' brains are not fully developed. And, our brains develop from the back forward. So the last part of the brain is the frontal lobes, which is executive functioning, judgment, insight. Doesn't now research shows develop until sometimes 23 to 26.
Yeah.
So I have my little joke that I tell parents that your kids are not going to like this, but your job is to be their frontal lobes for them. So you kind of have to keep holding them and be the voice of reason and rationality, even though they're not going to like that.
So your approach is really this integration, really based on where the family is, and then how do I meet them there, and then start pulling in what you need to really serve them and help them to meet whatever goal they may have when they come in and sit down and start to talk about what's going on. Would that be accurate?
I think also that it's important for the parents to realize where their kid is at. So it's kind of modeling, we're going to accept where you're at as a family. Parents, you also have to accept where your child is at. They may not be where you want them to be, but that's where they're at, particularly in cases where there's been some type of trauma in the child's history. And let's face it, these days, we all have some type of trauma in our history. They need to kind of key in on where their child is at developmentally. Because I've worked with a lot of traumatized kids, I can see that more clearly. I could even see facial expressions changing or body language. I worked with a boy recently who was 14, but he had a serious history of trauma, adopted at age 6, and he literally started to throw like 3, 4, 5-year-old temper tantrums, and needed to really talk with the parents about the fact that you need to not talk to him like he's a 14-year-old because he's not rational right now. You need to intervene with him where he's at developmentally, not chronologically. And I think that's an important intervention strategy for clinicians, but also for parents to understand, is a good old-fashioned timeout better than over-talking your child? That's another thing I work with parents on too, that we really try and rationalize with irrational creatures way too much. So sometimes less is more. You don't have to say something just because your child says something. In fact, sometimes it's best not to say anything. I always recommend 2 books for working with teens in this day and age. Anthony Wolfe talks about the developmental stage of I love you, I hate you. Get out of my life. First, would you drive me and Claire to the mall? But the one that's more relevant to what we're talking about is I'd listen to my parents if they just shut up. So, it's like those old Charlie Brown shows where they
Yes.
go, wah, 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 wah. So, just kind of working with parents on communication. That's another thing that I think is very important. I think we all have very different communication styles, and we need to recognize what our communication styles are. And they may be different than our child's. I worked with one family who the mom was very direct in her communication style and the child was very indirect. And the child would just shut down as soon as his mom started barraging him with really direct types of orders, and he never felt heard. So how do we teach communication styles are different, and that we need to use I statements? We need to do active listening skills. We need to do reframing with each other. That's one of the basics: connection, communication, and there's quite a few others.
Would you say the connection has to be there before the communication?
No, I think it's a parallel process. I'm working with a couple in marital therapy, and one of the bits of homework I did for them, and I do this a lot, is that till I see you next, you both have the homework of doing one random act of kindness for each other every single day, because I think that we get very busy in our lives. And this couple has 3 children, so it's quite the age range of different developmental stages that they're dealing with in very different ways. And so, how do you foster connection? I think you do it through communication as well, by doing the active listening, because people connect when they feel heard. But I also think that there's gestures sometimes that we can make for each other that just really fosters connection. So I think it's all parallel process.
Well, I like how you said that too, that even if the connections, because a lot of families will say that to me, we don't even know what to talk about with our child, or I'm just so frustrated. One father said to me recently, I heard you just saying some positive things about my son, and it made me realize I really focus on all the things he's not doing well. And I find myself always nagging or, yelling at him or complaining. And we talked about like, what if he would take a step back and he recognized that wasn't effective? And what if he started, more focusing on what he was doing well? How would that impact just the overall relationship? And I think the dad really found himself just out of frustration, just constantly thinking the kid was a failure and not doing well, and really reflected in the relationship.
I think that's key, Jackie. I really do, because I think that's human nature. And I do that type of educating also when I'm trying to help leaders lead their teams. Human nature, we have a tendency to just point out the negative. We don't point out the positives. Back in the old Maryville days, they had this model and they had a sign walking out of the staff office that said, catch 'em being good. And that, there should be 4 positives to every one negative. And I think that just making sure that parents understand that they need to point out the strengths as well as correct when kids are doing something wrong. As far as communication and going to, I don't even know how to talk to my kid. I think that I also always say that when kids come home from school, we have a tendency to say something like, how was your day? And they go fine. And then they go to their room. So I find that if you ask the same 3 questions every day to your kid, I did this with my son, tell me about one funny moment. Tell me about one really moment that made you feel good and one moment that made you feel sad. It gets them to talk a little bit more. Of course, my son was kind of funny because he was so indoctrinated with this that sometimes when he didn't really feel like talking, he would just walk in the door, look at me and go, this was funny. This made me sad. This made me happy. And then go to his. But, sometimes then he would open up about one of those 3 questions.
Yeah, I do that with my grandkids, and I've had the same thing. If I pick them up from school, they just know the questions and they start to answer. So that is quite fun. So Dr. Horan, when families are starting to go, I think we need some guidance and we need some help, what do you advise for those families? Where do they start? What would you say?
I think it kind of really depends on what stage they're at. Do they need help with once a week counseling? Does their child need help because their functioning level requires more of a partial? It really, again, back to where are they at? What are they willing to do? So I think that assessment is always key. I'm a psychologist, so I always believe in assessment first. So I believe in listening and talking to them and saying, maybe for one family, they're at this point and this would be the best course. And maybe for another family, a different direction would be best.
Well, is this approach an approach that you can work with any families or with all families, or do you find that it only works with certain families?
Well, I think that it works with all families, but you have to kind of adapt it differently depending on where the family is at. One thing I want to just kind of tangentially go into a little bit is conflict resolution, because I think that wraps back into what works with families and what doesn't. I think key in working with families, particularly with kids that are oppositional and defiant, is that we need to figure out what the family system dances. How do you resolve conflict? I think we bring our family of origin ways of resolving conflict into our current family situations. All families are going to have conflict. All relationships are going to have conflict. How we resolve it is key. I think that part of really helping parents raise kids is to model good conflict resolution, model that it's okay to disagree, model that we're going to listen and be respectful no matter how we feel, that it's okay to take a time out. I take timeouts from my husband sometimes. He for me, of course, but you just have to realize where you're at emotionally and if you're in the place where you can resolve conflict in a healthy and productive way.
I like that. Change, and that's what we're trying to help families do. What's not working and become more effective in their family system, as you said. In the behavior, we often hear families say, the behavior is getting worse. What would you tell families about that?
Always I tell them it's going to get worse before it gets better, because if you are trying to change the way that you as a family resolve conflict or communicate or whatever, there is a natural pull to continue things as they are. So if one parent or both parents are making changes, then the kid is going to really try to pull them back into the old way of behaving. So it takes patience. It takes consistency. I think consistency between caregivers is where I always start. That's the first thing. And I think that if parents are consistent or caregivers are consistent, then these changes will happen. But the kid will push hard for them to not be consistent. One of the things I ask, the first question in family therapy, is who's the good guy and who's the bad guy? Because we all have different tolerance levels. Some are easier than others and more laissez-faire, and some parents are more strict and just this is the way. Kids are adept at figuring out who to go to when. And so to get the caregivers on the same page so that they're consistent and have a consistent approach when you're trying to make changes, whether it's, okay, there's going to be consequences, this is the way we're going to deal with phones, whatever it is, they need to be consistent. So I think that it is going to get worse before it gets better because the kids are not going to believe you're actually going to stick to this program.
I like how you said that because right there, I think sometimes we start something and then it doesn't work in 2 days and we throw it out the window, or I might start a certain approach with my child, but then my child doesn't like the approach. So often I'll ask families, who's kind of leading the charge here? And they'll say, well, the child is. And we talk about, well, if a child's struggling, is that the best decision to put them in charge?
Right.
But I think so often we don't give things enough of a chance. Just in general, we're not patient, but really you might have to do the same thing for 2 to 3 weeks until you really even start to see a shift, because the children are going to wait you out and see if you're going to kind of revert back to old ways, right?
Right. I don't remember what the number of days are, but there's that concept that it takes, let's just say 14 days to change a habit. It's kind of the same thing that you really have to stick with it. One of the strategies that I use too, if there's a parent that is identified as a disciplinarian and one as a kind of fun parent, I tell them that just for the next week, let's switch roles. Fun parent, you do all the discipline. Discipline parent, you have all the fun with the kids. It confuses the kids, but it also gives the parents an opportunity to see what the other parent's world is like.
Are there any advice you would have for parents on how to handle severe acting out behaviors and disrespect? I know a lot of families will say, when I try to set limits, my child either rages, they become physically or verbally aggressive, they follow me around and they just keep asking me for the same thing over and over again, or maybe they seem more depressed and maybe I worry that me setting limits is making it worse. Any advice for parents on that?
I think if the family system is that point, then definitely you need outside help. And I think that maybe a partial program, maybe even if it's dangerous and aggressive, then you need to get them to an emergency room and just have an assessment done, because they need to understand that they're not going to be able to either scare you into doing what they want, or on the other end, like you were talking about, the depression or the anxiety, or emotionally blackmail you into doing what they want. So I think that if a parent is at that stage on either one of the continuums, they just really need outside help. And with outside help, then they'll learn the skills that this is how you behave when your child, if they're acting out, you don't talk. You disengage. If they follow you, if it's safe, go to your room and lock yourself in your room. If they start to become physically aggressive, then you unfortunately have to call the police.
Right. And that's a hard line for a lot of families. But I think, and I always say to families, don't threaten something or don't let, sometimes parents will say, if you do this, I'm going to call the police, or I'm going to do this. Make sure that you're willing to follow through with what you state.
Yeah, no, I think that's very important. I think, not just in that situation, but in general with consequence setting, I always advise parents, do not set a consequence when you're emotionally activated yourself. You can say, okay, we are going to revisit this in a bit of time, but there will be a consequence for this behavior. I need to talk to your dad about it, and we will let you know in a little bit of time. Because, parents are emotionally charged themselves, and they're like, okay, well, you're not going to play hockey for the next 3 years. Well, that's not realistic. They're being pulled to the same place that their kid is, rather than them remaining calm and modeling for the kid how to handle charged situations.
Absolutely.
Yeah, absolutely. Yeah, that's good advice.
Yes. Well, I think we are to the point we're ready to ask Dr. Horan our 3 questions. Are we ready, Jackie?
Yes, we are ready.
Okay, here we go. Dr. Horan, you can answer 1, 2, or all 3 of the questions. It's your choice. Let me read the questions and then you can make the decision. Number 1, what did you do as a child or teenager that would drive your parents crazy? Number 2, what is the biggest difference between children and teenagers today and when you grew up? And number 3, what does successful parenting mean to you? Take it away, 1, 2, or you can answer all 3. It's up to you.
Okay, I'll start with number 1.
Okay.
And I don't think this will come as a surprise to either one of you ladies. What I did that drove my parents the most nuts, also probably my siblings, yes, because they've told me, and sometimes my husband, is I kind of am queen of the last word. I always had to have the last word. I can remember a situation with my dad in the foyer, and I was arguing with him, and he just looked at me and said, "You bloody need to walk away right now, young lady." And I was like, ooh, I've never seen my dad that mad before. So I think that's what I did. I was very tenacious when I wanted to get my way. I think the difference between my generation and the current generation of when I was raised, as you ladies know, I'm a little older. So we were raised by fear. That's not okay anymore. I think there's a lot of course, that's the way to go. But I think that makes it more difficult for parents, particularly that were raised by fear, to figure out ways that are healthy and productive to kind of shape their kids' behaviors. I think the other big thing is, of course, everybody talks about social media. And Jackie, I've heard you speak and just really love the point that kids are never off stage. It used to be we would go home from high school and we would have to sit on our emotions and sit on our fights with our friends. Maybe you'd call one girlfriend on the phone and complain, on a landline in my day. But now it just blows up all night. And I think that's very unhealthy.
Yeah, for sure.
And I don't remember the last one.
What does successful parenting mean to you?
That your child is happy, understands that they're going to be sad and knows how to manage it, and finds their passion and does what they're meant to do.
Excellent. I like it. Thank you so much, Dr. Horan. It has been a great conversation today. Really enjoy seeing you today and being able to reconnect and learn lots of great things. So thank you.
Thanks for having me.
There's several things you said that I always think about when I'm working with families and always use. You have some, I love just reminding families about it does get better and it's normal for your kids to love and hate you at the same time. And the importance of consistency. I think, some of these key strategies really do work. And I notice when I use them with families, there is better communication and better relationships overall. And sometimes it's even about families being able to laugh and not sweat the small stuff.
Right.
I appreciate it. So thank you so much and have a great day, both of you.
Thank you.
Thanks, listeners. And we will see you later. Bye, Jackie.
Bye.
Thank you for joining us, and make sure to subscribe and like us to catch our next episode, where we will take you on a journey to find new ways of successful parenting.